What is Ceftum? Ceftum 500mg tablet is an antibiotic belonging to the cephalosporin class, used to treat various bacterial infections in these areas: lungs, nose, mouth, ears, skin, urinary tract, including Neisseria gonorrhea. It contains Cefuroxime, which inhibits bacterial cell wall synthesis, leading to bacterial death. What are the benefits and uses of Ceftum? Ceftum is primarily used to treat bacterial infections in various parts of the body. Its broad-spectrum activity makes it effective against many different types of bacteria. Conditions Ceftum treats. Ceftum is commonly prescribed for treating respiratory tract infections, bronchitis, pneumonia, laryngitis, sinusitis, ear infections, throat and tonsil infections, pharyngitis, tonsillitis, urinary tract infections, skin and soft tissue infections, gonorrhea and other sexually transmitted infections, Lyme disease. Secondary uses of Ceftum. Beyond its primary applications, Ceftum may also be used for prevention of surgical site infections, treatment of bone and joint infections, management of complicated intra-abdominal infections, therapy for certain types of meningitis. How does Ceftum work? Ceftum works by interfering with bacteria's ability to form cell walls, which are crucial for their survival and reproduction. This mechanism of action is both effective and selective. Cefuroxime, the active ingredient in Ceftum, is a bactericidal agent that acts by inhibiting bacterial cell wall synthesis. It binds to penicillin-binding proteins, PBPs, in the bacterial cell wall, preventing the final transpeptidation step of peptidoglycan synthesis. This interference leads to the formation of holes in the bacterial cell walls, ultimately causing the bacteria to die. Ceftum is effective against many gram-positive and gram-negative bacteria, including those that produce certain types of beta-lactamase enzymes that would typically destroy other antibiotics. How to use Ceftum. Follow a registered doctor's instructions or the directions on the bottle. Take the whole Ceftum 500mg tablet and swallow it whole. Ceftum 500's absorption is unaffected by food, so it can be taken with or without food. Physicians usually prescribe 250 mg of Ceftum a day to patients with tonsillitis/pharyngitis, sinusitis, bronchitis, or skin structure infections. In severe infections like pneumonia, the dosage can be 500 mg twice a day. Ceftum dosage. Proper dosing of Ceftum is essential for effective treatment of infections while minimizing the risk of side effects. The dosage varies depending on the type and severity of infection. Typical dosage instructions. For most adult infections, 250 to 500 mg taken every 12 hours for 10 days. For gonorrhea, a single 1 gram dose. For Lyme disease, 500 mg every 12 hours for 20 days. For children, who can swallow tablets, 250 mg twice daily for 10 days. For children 3 months to 12 years, using suspension 20 to 30 mg per kg body weight per day, divided into 2 doses. What should I do if I miss a dose of Ceftum? If you miss a dose, take it as soon as you remember. However, if it's almost time for your next dose, skip the missed dose and return to your regular dosing schedule. Do not double the dose to catch up. What happens if an overdose? An overdose of Ceftum can cause serious health problems, including brain damage that may result in seizures or coma. If you suspect an overdose, seek emergency medical attention immediately. What are the side effects of Ceftum? Like all medications, Ceftum can cause side effects, though not everyone experiences them. Understanding potential side effects helps patients recognize when to seek medical attention. Some of the common side effects of Ceftum are rash, vomiting, allergic reactions, increased liver enzymes, nausea, diarrhea, headache, dizziness, stomach pain, raised liver enzyme, muscle pain, weakness, redness of skin, fever. It can cause some severe side effects and can lead to some serious health problems. Talk with your doctor if you are having any serious issues. Precautions and warnings. To ensure safe and effective treatment with Ceftum, it's important to take certain precautions. Before starting this medicine, inform your doctor if you have any history of allergies to Ceftum or similar antibiotics. Who should avoid this medicine? Ceftum should not be used by people with known hypersensitivity to Cefuroxime or other cephalosporin antibiotics. Patients with a history of severe allergic reactions to penicillins or other beta-lactam antibiotics. Conditions where caution is needed. Use Ceftum with caution if you have. Inform your doctor about any medical history, including kidney disease, liver disease, stomach ulcers, or abdominal pain, before taking Ceftum. History of seizure disorders. Phenylketonuria, PKU, as some forms contain phenylalanine. Pregnancy and breastfeeding. Ceftum 500mg tablet is commonly thought to be safe to take while pregnant. Animal studies have shown that there are little to no adverse effects on the developing baby. Before taking any drugs, talk with your doctor while you are pregnant. Ceftum 500mg tablet is generally safe during breastfeeding, as only low amounts are excreted in breast milk. However, it should be used cautiously, and the baby should be monitored for signs of adverse effects such as diarrhea or yeast infection. Are there any age restrictions for using Ceftum? Ceftum is not recommended for infants younger than 3 months of age. For children who cannot swallow tablets, the oral suspension form should be used instead of crushed tablets. Alcohol or food interactions. While taking Ceftum, alcohol consumption is not specifically contraindicated but may increase the risk of side effects like dizziness and drowsiness. Ceftum tablets may be taken with or without food, but the oral suspension should be taken with food. Possible interactions with other medications. Ceftum may interact with certain medications, potentially affecting treatment outcomes or increasing the risk of side effects. Medications that may interact with Ceftum include antacids and drugs that reduce stomach acid, which may lower the bioavailability of Ceftum. Probenecid, which can increase blood levels of cefuroxime. Live bacterial vaccines, which may not work as effectively when taken with Ceftum. Blood thinners like warfarin, as cefuroxime may increase their effects. Always inform your healthcare provider about all medications you are taking, including prescription drugs, over-the-counter medications, and herbal supplements. How should Ceftum be stored? Proper storage of Ceftum ensures its effectiveness and safety throughout its shelf life. Recommended storage temperature for Ceftum. Store Ceftum tablets at room temperature between 59 degrees Fahrenheit and 86 degrees Fahrenheit, 15 degrees Celsius and 30 degrees Celsius, away from excess heat and moisture. Keep the container tightly closed. For Ceftum oral suspension, store it in the refrigerator and discard any unused medication after 10 days. What happens if Ceftum is not stored properly? Improper storage may lead to degradation of the medication, potentially reducing its effectiveness or causing it to become harmful. Exposure to excessive heat, moisture, or direct sunlight can affect the stability of the medication. Always keep Ceftum in its original container, away from children and pets, and do not use expired medication.